Good afternoon, everybody. We are at 1 o'clock. I see quite a few people logging in. We will just wait a minute and let people log in. So thank you for your patience. We will begin shortly. Hello, everyone. Thank you for your time. I would like to welcome everybody. I thank you for your patience. We do still have some people logging in, but I would like to respect your time and get started. Again, welcome. My name is Didi Castilla, and I am the Human Services Transportation Program Manager here at MAG, and I will be your host today. I am a Native American female with dark brown hair, glasses, sitting in front of a desert landscape background. We appreciate you taking your time out of your busy schedule to spend the afternoon with us. Before I begin, I would like to introduce Ezequiel Rota to provide some housekeeping items.
Hello, everyone. My name is Ezequiel Rocha, and I am the Human Services Transportation Planner here at the Maricopa Association of Governments. I have just a few housekeeping items before we get started. The controls for this meeting are located at the bottom bar of your Zoom window. Please enter your name and the organization you're with on the chat box. If more than one person is watching using one computer, please enter the name of all the people attending the meeting today. Also, use the chat box if you have any comments or technical issues, and we'll do our best to assist you. If you have a question to the presenter, you can either use the chat box or voice your questions when the presentation opens for questions. We ask that you keep your microphone mute at all times during the presentation. This presentation is being live captioned. If your captions are not already showing, you can turn them on by clicking on the CC option on the bottom menu of your screen. This meeting is being recorded, and a recorded version of this meeting will be available at the MAG Human Services Transportation website. For those who just joined us, welcome to the meeting. Now it's back to you, Didi.
Thank you, Ezequiel. Next slide. I would like to just go over the items for the agenda today. We will have a Valley Metro updates from the city of Phoenix, updates on COVID-19. We will have a presentation from the Arizona Developmental Disabilities Planning Council. An agency spotlight is the ARC of Arizona. I will provide some regional human services transportation updates, and we will have a presentation from our sub-regional mobility managers. Thank you. Before we begin, I would like to start off with the polling questions to give our presenters an idea of who we have with us today. So as a kid, if you can pull up the first poll, what type of organization are you representing? Is it an agency, a government agency, municipality, nonprofit, profit-for-profit, citizen, or other? I just give you a couple of time. Okay. And I see from the polling results that a majority of you, 76% today, are from nonprofit agencies. We do have some government agencies with us, welcome, and some municipalities. Again, we would like to welcome everybody today. Our first presentation is from Valley Metro. Valley Metro is a great partner in the transportation world. They are a resource for our stakeholders and our consumers, especially for those where it's appropriate, where it's available. So I would like to welcome Guillermo Gonzalez, who is the Valley Metro Program Supervisor for Accessible Transportation Services, who will provide the Valley Metro updates. Guillermo?
Thank you, Dee Dee. All right. My name is Guillermo Gonzalez. I'm also here with my counterpart, Trevor Ebersol. He is a paratransit and ride choice program supervisor. Just to kind of get right into it, our ridership, it has been pretty steady at about 2.3 million on the bus for August, September, and October. The light rail has been in the 700s, and it's in the higher 700s for September and October. The streetcar had remained pretty steady for August and September, but had a pretty big boost in October to a little bit under double to 59,000. Paratransit has remained steady and the higher 27,000s. Ride choice is also remaining steady in the high 14s, low 15,000s. Next slide, please. I'd like to talk a little bit about the proposed April 2023 service changes. Next slide. So routes 35 and 36 are changing a little bit. The new route 36 is being proposed to operate from Metro Center, where all of that Northwest extension off of Dunlap is happening, all the way onto the 35th Avenue and North Valley Parkway. And it's going to continue to connect to Route 35, as you can see in the screen there. Next slide. Route 28 is extending from 75th Avenue all the way to 99th Avenue. Next slide. Here we have on Route 61, this is going to help our buses have a cleaner turnaround rather than through Hidalgo. So they're extending it all the way up to 51st Avenue. It also helps connect with other areas there. Next slide, please. Here we are proposing to eliminate service south of Pecos Road on Route 96 on Dobson Road. Next slide. Here the surprise exchange, there's no real change other than the rerouting. It's not going to go through Grand and McDowell anymore. We're going to stay within the city to make sure that we have accessibility to more customers, since Grand is a very busy street. All right, next slide, please. Here we're going to be eliminating, we're proposing to eliminate the north portion of the overlapping route with 557 and the start to end route at the Glendale Park and Ride. Next slide. In Avondale, we're planning on extending the Avondale Park and Ride. So we want to extend the Zoom route all the way up to the Park and Ride that's next to the 10. Okay, next slide. These proposed service changes, if approved, would take effect on April 24th, 2023. To learn more or to give feedback or concerns regarding any service changes that we have throughout the year, you can always go visit our website, valleymetro.org/service-changes, and they'll have instructions there where you can give comments or see what proposed changes are coming about. Next slide, please. So we're going to talk a little bit about project overviews that were happening right now throughout the Valley. Next slide, please. Over here on the Northwest Extension Phase 2, that bridge construction you see on I-17, the track workstation installations is continuing. However, the utility relocation has been complete. The crews are also working on the bridge now, making the elevated station, and they're going to start to bring in some of the art that's going to be on the station in early 2023. Next slide, please. Here you can see some track installation that's happening on Dunlap Avenue. Next slide. And here's a current picture of the Metro Parkway station, the elevated light rail station that's going to be connecting to Metro Center. Next slide. This is our stairway. Here on this stairway, there will be an escalator installed. For the time being. There are steps so our workers can get up and down, but there will be some artwork here as well. Next slide, please. Here's some more rail installation that is leading up to the bridge. As you can see, it is on an upward slope that's going to be going over the I-17. Next slide. So the South Central Extension and Downtown Hub. I am proud to say that this project is about 50% complete. The station structures are being installed in downtown Phoenix. The utility relocation still is continuing down South Central. And beginning January 23rd, most of the major traffic and pedestrian restrictions in downtown Phoenix will end. So that's a big happy for us. So people will be able to get through. I know it has been pretty hard, but thank you everybody for being patient with us through this construction. Next slide, please. Here you can see an aerial view of new track being installed on Washington Street, crossing First Avenue. Next slide. And here you can see some utility relocation on Central Avenue and Hadley Street. Next slide. As you can see here, we're installing station structures on Washington. This is between First and Central Avenues where there will be a station. So they're starting to build up the stations for our light rail system there. Next slide. And this is a pretty fun one. The Phoenix logo was installed on the pedestrian only plaza at Cityscape. So that looks pretty sharp now. Next slide. If any of you are using our light rail system or our buses, you've been noticing a little bit of new machines or fare technology happening. So I'm going to talk a little bit about our fare technology modernization project. Next slide, please. As you can see, we have installed some new fare readers on our buses. Those purple fare readers are going to be working with our mobile fare. These fare readers are also going to be installed on light rail stations. Right now, the public pilot recruiting has been completed, and we will be starting the public pilot in December. Next slide. The pilot testing will be testing mobile fare purchases, pass activation, and new fare readers. And we're going to have surveys about the experience that's happening. Like I mentioned, this test does begin in December, and the public launch is expected in January sometime, based on the results of the pilot, though. Can you go ahead and play that little slide there, or the little video? Oh, can you go back, the little video? Is this a PDF or is it a...
This is a PowerPoint presentation. Give me just a second.
It may have not come out because I was only able to send a PDF. Anyways, it was a short video of somebody actually using the fare reader on at a light rail station, one of the new fare readers. They are kind of look similar to a parking meter with a little purple cover, and people are going to be able to scan their phones underneath because a QR code will happen, and we'll be able to have mobile fare there. There's a fare reader I was talking about. So we may not be able to see that. It's a very short 3-4 second video. So
I was just able to play it and now it doesn't want to play.
Okay, no worries. Yeah, it was just someone handing the cell phone underneath the reader there, and then they were able to read it. So
Give me just one moment while I reset it.
slide 26. Oh no, sorry. It's keep fair modernization. Right, next slide. Okay, if you'd like to know more information or see where this is going, our Fair Technology Modernization webpage is valleymetro.org/fair technology. Here you can see the various phases that we are occurring in our project. Here you will see when the cards are going to be active, when the new reloadable cards will be taken into effect, and when everything is going to be finalized, which will be in 2024. So if you have any questions or just feel like learning a little bit more about the project and upcoming changes with this, you could always come to this webpage. If not, we'll be here to give you an update in the next quarter. Next slide, please. Holiday seasons is here. We wanted to invite you all to downtown Mesa for our Mesa Santa Express boarding at Mesa Drive and Main Street stations, December 9th, 10th, 16th, and 17th. In downtown Mesa, there will be lots of merry Main Street, basically, from November 25th to January 9th. So you're more than welcome to come and join us, and hope to see you at the Santa Express. Next slide, please. Again, I'd like to invite, I see that there's a lot of nonprofits out here that work with a lot of elderly and people with disabilities. I'd like to invite you to consider joining our VMAG group. Next slide, please. VMAG helps us better execute our projects by getting your advice on some projects. Currently, right now, some of our VMAG members are being asked for our wayfinding points on our Northwest Extension rail station. They have vision impairments, and they're asking them for their opinion because we may be too close to the project, so we ask for other opinions. So I invite you to join us. You know, you can be a senior, 65 or older, a person with a disability, caregivers, or a senior with a person, the caregiver for a senior or a person with a disability, or in this case, an employee or a volunteer of an organization that serves senior or people with disabilities. We like them to know that we prefer people that use our transit system. That way they can actually give us their point of view on the accessibility of our entire transit system. Next slide, please. If you are interested, you can apply online at valleymetro.org/accessibility/advisory-group. You can fill out an application online, and then once we receive the application, we will set up an interview where we will ask you a couple questions regarding your interest to be a VMAG member. If you have any questions, you could always email vmag@valleymetro.org. Next slide. Alrighty, thank you. And do I have any questions?
Thank you, Guillermo. Yes, definitely. If you have any questions, there is a question in the chat. This is from Samantha. She says, "I'm curious. Do these mobile fare devices also enable easier tracking of ridership data?"
Oh, that's a great question. Thank you, Samantha, for asking that. So our mobile fares are only the first step in that. Customers are going to be able to even look at their ridership data, look at their rides, look how often they're riding. They're going to be able to reload their ride cards, and it's also going to enable us to have a little bit better data, so we could make sure that we are reaching the demand of the public here in the Phoenix metro area. So yes, it is going to be easier tracking, and it is introducing self-tracking for the customer as well, as a customer portal does come into effect around the middle of 2023, late 2023.
you, Samantha. If anybody else has any other questions, please feel free to write it in the chat. I have a question regarding some of the light rail raised platforms. Would there also be an elevator component for those using, mobile devices?
Absolutely. There will be an elevator at our raised station at Metro Center. There will also be an escalator. It will be 100% accessible.
Thank you. And I would just also like to make a plug for the VMAG group. We do have somebody says awesome. That's great. We do have quite a few nonprofit organizations here. This is a great opportunity to see the services that are changing, the improvements that Valley Metro is making, and an opportunity to give feedback and comments. We're really appreciative that Valley Metro has made the VMAC group and is opening up to the consumer. So I would highly recommend those of you who have consumers riding transportation or you ride transportation to take advantage and apply for this group.
Thank you, Dee Dee.
And if you have any questions later on, after you hear all of this information, feel free to email myself or Ezekias, and we can forward that on to Guillermo. We've had a couple of people done that in the past. So Guillermo, thank you so much for your presentation. And again, public transit is an alternative transportation that is available. It's on the schedule, and as Guillermo just mentioned, they're always trying to do improvements to better the services to our community. So thank you so much. And I like your background.
Oh, thank you.
Thank you. So before we go on to our next presentation, I would like to do a poll. The next polling question is, are you a Section 5310 subrecipient representative? Yes, no, but would like more information. And I'll give you just a couple of seconds for that. I also answered the poll because MAG is a subrecipient of 5310 funding. And 84% of you here today are subrecipients. So welcome and thank you for joining our meeting. 10% are don't. And we do have a couple of people who said they would like more information. And definitely, if you would like more information regarding Section 5310 program, feel free to thank you, Ezekias. Ezekias put in his email address into the chat. Feel free to email Ezekias, and we can make an appointment to meet with you and give you more information regarding 5310. So I would like to now introduce and say congratulations to Wendy Miller, who is now the Federal Grants Administrator for the City of Phoenix Public Transit Department, and our designated recipient representative, who will provide an update on the Section 5310 program. I'd like to welcome Wendy. Thanks.
Thank you, Dee Dee. Good afternoon, everyone. So happy to be here. I just wanted to say happy holidays to everybody. We're barreling quickly towards the end of December and all of our fun activities, so I hope everybody's ready. Just a couple of updates, and these are in reference to the Section 5310 application process that we are working on for 2023. Can you imagine that? I just wanted to give a couple updates so that for people, for planning purposes who are looking at applying for next year, I just wanted to give a couple of plugs for a couple of changes. First of all, regarding the vehicles, we are just currently in the process of placing the orders for the vehicles from last year's process. So it's taken, of course, a long time with our supply chain issues and contract issues. So we're fortunate to be finally placing the orders for our ADA vehicles. Those are our cutaways, our transits, and our minivans with ramp. Unfortunately, we still do not have a current contract and Buy America FTA compliant vehicles for our non-ADA, meaning our passenger vans and our standard minivans. So with that being said, in consultation with our other staff and our powers that be, we've made the determination that the city of Phoenix next year for this next process is not going to be offering the option of requesting standard minivans and passenger vans until we are able to identify an appropriate vehicle substitute. We're not going to be able to offer those in this next process. So for those of you that were planning on asking for vehicles next year that potentially need those standard vehicles, I would look at the potential of talking to your budget folks and talking to your administrators about supplying those vehicles if they're needed outside of the grant, if possible. That we're just struggling so hard with Buy America issues. The federal government has issued a waiver allowing us to buy certain vehicles, but there's not very many, and ADOT does not have a current contract with those. So as we're struggling through that is one issue that we're experiencing, and just wanted to let you guys know in advance that that's likely going to be the case that for this next year. For those agencies that do have been awarded and prefer those vehicle styles, we're doing everything we can to figure out something. But again, we don't have an option. And if those vehicles, if we are able to determine a vehicle style that is appropriate, we would be making that change and making those available for the 2024 process. So just giving everybody a heads up. Secondarily, the other main big change and big issue that we were experiencing, a lot of this is having to do with COVID and operational shutdowns of the 5310 service. But for those agencies that have awards of preventive maintenance and I think it predominantly has affected that type of application, where when services shut down, people that had preventive maintenance awards were not able to spend those funds down very quickly. And so they have more than a year's worth of funding on file for that purpose. And what we've been informed through our FTA triennial review and in consultation with our FTA analysts, they have recommended that we not award funding for projects for folks that have more than a year worth of funding on the books. So they're recommending that we delay those awards. So if you're planning on applying, please review the amount of funding that you have on the books. If you're curious about what that is and you're not certain, please reach out to me and my staff, and we can give you an update of where you're at currently with how much funding you have for certain projects. But we will be giving a presentation and reviewing that information and providing that feedback to the committee so that we will recommend for those asking for additional funding that have too much on the books that we not award those funds. So please make sure that you're evaluating that prior to applying. And if you have questions about that, please reach out to my staff. And with that being said, I'll look and see. That's all of my updates for now. And I'm sure we might have a couple of questions.
Wendy, yes, we do have a question from Billy Parker. And he writes, so Wendy, what I'm hearing is that only lift-equipped vehicles will be an option for 2023 contract year, correct?
That is correct, Billy. Lift and or ramp equipped vehicles. So the ADA accessible vehicles with lifts and ramps, All Stars, which are the cutaways, the Ford Transits, which are the raised roof vans, and then the minivans with ramp, or the Braun Amerivans, or whatever style they're putting those together. Those, we are not going to make those available because we don't have a current way of purchasing those vehicles. So we're trying very hard. We're working with ADOT, we're working with FTA, we're evaluating different options of trying to make those available. And in addition, I've also just recently sent to our FTA analyst, who has passed that information on to the administrators at FTA. We've let them know what a big impact that this is to our subrecipients, and especially those providing these 5310 services. They do understand that there is an impact, and we're providing feedback to them to let them know all the different ways that this is impacting. You know, it's in addition to not having vehicles available, those vehicles also, became more expensive. We let them know about all of the funding that we had to put forward to an increase, and the impact that it had to your agency. So we are passing along that information. I mean, they're aware of it, but we're giving specifics on, for our region, how that's impacted you. So just wanted you to know that we are advocating for you and this program, to let, any opportunity for them to provide a waiver or change to rules and regulations that make it easier for us to procure vehicles for you. We're trying to figure out, what options there are. And it is a slow process. And for that, I do apologize. And our hands are tied. I wish there was more we could do, but that's the current state. So again, any questions?
Definitely, if you have any other questions, please put in the chat. We do have quite a few people saying thank you, Wendy. I would like to echo that. Thank you, Wendy. We know this has been an ongoing issue since the beginning of the year with our odor awards contract, and the city of Phoenix, Wendy and her staff have been working diligently in ensuring that you get the requests that you applied for. Unfortunately, a lot of this is out of your hands, and this is being felt nationally, not only in the region, not only in the state, but nationally. And we really appreciate your hard work and being an advocate for this program. And yes, City of Phoenix has been very vocal, and we are greatly appreciative that providing feedback to FTA whenever they call for public comment. Are there any other questions? You're welcome. Thank you. Are there any other questions for Wendy while we have her? Okay, and as always, if you have any questions after this, you can email Wendy or myself or Ezekiel, so we can forward that on to Wendy. So thank you so much. Okay. Without any other questions, I will move on to our next presentation. When we last met in September, it was 100 degrees. Today, I believe we are at 53 degrees, and we're feeling the winter temperatures. As we head into the holidays and social gatherings that may take place, we are pleased to have with us today Lori Thomas, Manager of Healthy Aging, to provide information and updates from Maricopa County Department of Health regarding COVID. So thank you, Lori, for being here today.
You're welcome. Well, I love this weather, and I hope everybody else does too. It's such a welcome relief, and it just makes me feel like holidays and fall, which we don't get to feel a lot of. But however, at the health department and in our state and all across the country, we are experiencing, I guess, a tridemic. And we talked about that a little bit in September with RSV, with the flu, and with some COVID. So let's talk a little bit about that. Okay, next slide. Next slide. A little bit of an RSV alert. Common measures to control the spread of the respiratory virus. You all know what they are because we used them during COVID. So if you're sick, stay home, stay away from others, wear a well-fitting mask, cough in your arm, use the public health cough, those types of things, frequent hand washing, covering your cough and sneezes, disinfecting surfaces, all of those things that we did during COVID can help decrease RSV and the flu. Next. This is laboratory confirmed flu cases in Maricopa County. And as you can see, even though it might look a little bit tiny there, we have much higher numbers now than we did in prior years. So we are in extremely widespread flu in our area, in Maricopa County and across the state. So that's just shows you a little bit about where we are. I'm sure you've heard on the news that hospitals are full, not so much full of COVID, but of flu and RSV. Next. Next slide. Okay, these are laboratory confirmed cases of RSV. And as you can see, it looks like we are much higher than in years past as well. And we all know that most people don't go to the lab to get their flu case identified as influenza. So most people just get through it at home. So you can see we have a big peak and it may continue to grow. So you can take a look at that in the demographic data. Next. This is our COVID national count. And as you also note that our peak was in 2021 and December of 2021. And even though we are seeing an increase for this year, it is nowhere near what it was last year. So we still do have people getting COVID, some for the very first time, but we aren't seeing anything like we have in years past. Next. The next slide is going to show county cases by date. And you can see a little closer up view that COVID cases are increasing by date, but that is a very close-up view where the other one was at a further distance. So there are cases of COVID still going around. Okay, next. There is the epi curve for COVID-19 for the last 60 days. So you can see the trajectory is up. It's still happening. Now, I want to say that many of those cases, the majority of those cases are in long-term healthcare facilities. And sadly enough, only about 23% of long-term healthcare facilities have their latest boosters. What's the reason for that? It's apathy. It's trying to reach family members to give consent for those who are able to give their own consent. It's a number of different reasons, but only about 23%. And that's difficult because that's where the largest amount of outbreaks occur and those that are most seriously affected are. Next. These are the COVID hospitalizations for the last 60 days in Maricopa County. So that you can see new admissions were up about 16% in the last 60 days. And there's only been about a 1.2% increase in inpatient beds. So dramatically smaller increase than prior, and a 1.4% increase in ICU beds. So that is all good news. And we think that, of course, is due to the fact that we do have a lot of people immunized. But there are many more that could be immunized and save themselves from serious illness, and in many cases, death. And we'll see in a slide in the future here that we had 42 people die. I think it was in the last week, still from COVID. Next. Okay, talk about vaccines and therapeutics next. Okay, we're going to talk about bivalent COVID boosters. They are here. And what is a bivalent booster? Those are vaccines that fight against two different strains or variants of COVID, the original strain and the Omicron. So when you get these new boosters, they fight against two types. So it's kind of double the protection. So that's the good new news. And everyone 5 years and older should get a bivalent booster 2 months after their last vaccine. You can mix and match, but the caveat here is bivalent vaccines are not available for your primary series. Do you remember you had a first immunization and a second immunization? That was usually a Pfizer or a Moderna, and they wanted you to keep with Pfizer or keep with Moderna for your both first and second shots. If you have never been vaccinated, you are not encouraged and you are discouraged from having a bivalent immunization. You need to go back and have the first and second immunization. And it is also okay to get your flu shot and your COVID booster at the same time. They don't have any effect on each other in a negative way. So there you go. Okay, next. Mpox, which was formerly known as monkeypox, that's something that we've been working with at Public Health. It has now been not considered a national, I want to say not disaster, but a national concern as much as it was. We are grateful that those affected have been able to go to vaccine clinics for post-exposure and pre-exposure prophylaxis. And we are just very grateful that that has been brought under control. Appointments are still can be made by the CARES team. That's 602-506-6767. And you can go to that website, and those are free. Okay, next. And let's go to next. Okay, for our community level, we're at medium, but for in a hospital and a healthcare setting, it is high. So go to the next one. Everybody has a different, the CDC has different levels of that they rate the amount of spread. And so our community level is medium, but you'll see that in the northeast part of the state, it's still very high, Navajo and Apache County. And then in our southern part of our state, it is still very high. So that is for you to take a look at there. Other parts of the state, the county are still, country are very high as well. Okay, next. The transmission, COVID transmission is what we measure as to be high. This is what I was mentioning with the healthcare settings. It is still very, very high in our healthcare settings. And you may ask, how can that possibly be with all the precautions that are taken? And it's simply that people are very sick in hospitals and they come in with COVID and they come in at high risk. So that for our healthcare settings is still very high. We also have a very elderly population in Arizona who are at the most high risk. That's why you're going to be asked when you go to a healthcare facility to wear a well-fitting mask. And many people are not allowing young people under 13 to go into the hospital because of RSV. So you need to check regulations if you're going to visit someone in the hospital at this time. Next. COVID community transmission. This is where I was telling you that the deaths, where there was 42 and I guess it was a weekly total, the last weekly total we have, and that's too many. So any is too many, but 42 seems like a lot for a week in the county. So there we are. We are at almost 180 people that have COVID per 100,000. And we have about 25% of the population that are testing positive. That, of course, many of those obviously think they have COVID when they come in. But the rate could be much higher only because most people don't report their positivity, don't report that they have a positive rating, or don't even take the test. But many people are surviving through the COVID and not having the deep symptoms that they once could have had. Next. Someone asked me in an earlier presentation why there was such widespread in assisted livings centers and adult care settings. And one of the reasons, and I mentioned others, but some of our lower level attendants are not required to have immunizations. And why? And so that can help in the spread. Health workers are very difficult to find long-term and to keep them. And so that has not been a requirement for nurses, aides, or health aides, or housekeepers. And so that is yet another reason why long-term care facilities and adult day centers often have a higher rate. Next. Okay, prevent the spread of flu. As we talked about earlier, many of the things that we did for COVID to protect ourselves and others, we can do to protect ourselves from the flu. And you can get virus droplets from a cough, a sneeze, a nose, and a surface. And if you have direct contact with the virus and you kiss the face of a person with the flu, you can also get the flu. Drinking after someone, there's many ways to get the flu from someone. So just trying to be very careful with that. You can talk to your doctor about flu antivirals, but trying to keep people out of the hospital with flu. Just out of curiosity, how many people on this call have had the flu in their family in the last 30 days? Can I just see a raise of hands? Okay. Okay. Well, it isn't fun. It isn't fun. That's for sure. Okay, next slide. Oh boy, somebody's saying 4 people, including myself, lots in the chat. Okay, next slide. Next slide. Okay, if you have any questions at all, we invite you to call our CARES team at 602-506-6767. And this team is great for all kinds of things. If you want to have help for an immunization, if you want to see how you can get a ride for an immunization, if you have questions about your children's school and COVID, all kinds of questions, call this number and we will find the answer if we don't have it. So they're a great resource for you. So another great resource is Find Help Phoenix, and that's for low cost and no cost resources for those that may be needing those, for dental, for glasses, for braces, for all kinds of food banks. And that is, and I'll put it in the chat, the URL is find, F-I-N-D, help, H-E-L-P, Phoenix, PHX.org. And I will put that in the chat. Okay. Oh, someone already did. Thank you so much. All right. Are there any questions that I could answer for you?
Hi, Lori. We do have we do have one question in the chat. And Mr. Younger is asking, how many COVID boosters are we supposed to have? For example, I've had the initial 2 in February 2021 and then a booster in November 2021. Do I need another one?
You know, that is going to be up to you, but there is another one available, and that's the bivalent one that's for Omicron and the other one. So if you were totally up to date, you would have 4. So that bivalent came out. You had had the first 2 series that were the Pfizer and the Moderna. Then you would have had booster number 1, and then you would have had booster number 2, which came out most recently. But of course, those are totally up to you. But it's certainly interesting to see. We know that people are less and less ill, who have had the boosters. So we are not seeing the deaths or the violent illness or the serious illness or hospitalizations that we did before, because more people have been immunized. So it is certainly up to you. It is certainly recommended if you are around, if you're over 65 or you are around people that are, or if you have complicating comorbidities.
Thank you, Lori. And I've been on a couple of webinars regarding updates on COVID, and I was surprised at how many people had asked questions regarding getting their first shot. And I'm surprised by that, but I think it may be because COVID's been going on for so long. But it was advised that you would need the primary shot before you got the most recent shot.
And you know, it's just very interesting what motivates someone to finally get a shot or get an immunization. Motivation is different in every area. We have found that some people that didn't get COVID did get the flu, and they now are thinking that maybe they should get COVID because they don't want to have this terrible flu experience. Although the viruses are different, it's just been interesting that we do have quite a few people getting the first shot. And, you know, we're grateful for whatever people are willing to do. So we have first shots available, and you can call that number 506-6767, and we can tell you an area that's close to you, and you can go get it done, or you can, there's just, and they're free, of course. One thing I did want to mention is that if you are homebound, there are mobile organizations that will administer the shot, but there aren't any more that they will charge you for the quote office call. That the immunization is free itself, but they probably will charge you for the office call for sending the nurse or whoever they're sending to your home. But there are a group, and if you call this number, they can give you a number for people that will go to your home. If you are not able to leave your home for whatever reason.
Thank you, Lori. And Marcia had asked the question of how much does it cost for the bivalent dose, and again, it
No
said
cost.
that it is free. Awesome.
Yeah, no cost. That's right. No cost. And if you want to go to maricopa.gov/COVID-19, you can see most of the places that the county is offering those free sites. Or you can call that number and they can make you an appointment. But there isn't a cost unless you are using a mobile unit, or now if you go to your physician's office, they may charge you an office call, but they wouldn't be charging you for the immunization itself, the vaccine itself.
Thank you, Lori.
Okay, and we thought this was not going to drag on much.
I was just going to mention when we first had you on almost close to 2 years ago, we said, if we need to, we'll keep bringing you on. And you have been here and providing these updates, and we greatly appreciate it. Unfortunately, we will continue to have you on as we hope to get this under control. But thank you so much for all your information and making sure that we are going into the holiday celebrations with some good techniques.
Well, good. And I wish you, and the health department wishes you all good health.
Thank you very much.
Okay. Bye.
Bye. And if you have any questions for Lori, if you think of some questions after this meeting, feel free to email Lori, and we will have the presentations on our website. So thank you. I would now like to move on to our next agenda item. And the purpose of our meeting is to provide you with information and resources to assist you in your work that you do in caring for our community. Today, we are pleased to have with us John Myers, the Executive Director of the Arizona Developmental Disability Planning Council. And he has been with the Planning Council for since March of this year. So welcome, and thank you for your information today.
Thank you very much. I appreciate the opportunity to be with you today. Let me see if I can get my screen to share, and I will provide you the information about the DD Planning Council. Again, thanks for the opportunity to be here this afternoon. I noticed a number of people on the call. I recognize people I've worked with in a variety of ways over the last few years. It's a pleasure to be able to share information on the council with you. As you said, I've been with the council since March of this year. I was formerly with the ARC of Arizona, and you're going to, of course, be hearing from my successor at the ARC of Arizona in a little bit. I will say that much of the work that the council does, that the Developmental Disabilities Planning Council does, is similar to what organizations like the ARC of Arizona do. We are heavily engaged in public policy work and advocacy work on behalf of people with intellectual and developmental disabilities. In fact, the Arizona DD Planning Council is one of 56 councils around the United States and all of the territories. It is a federal requirement that there be a council in each state and each of the territories. That includes, of course, Guam, American Samoa, the Marshall Islands, U.S. Virgin Islands, Puerto Rico, and one other territory that I always forget, and I apologize for that, but all 50 states plus the 6 territories of the U.S. And our job is, even though we're housed within the Department of Economic Security here in Arizona, we are federally funded and not technically not a part of DES. Our job is to be independent advocates for people with intellectual and developmental disabilities, and even more broadly for the disability community in general in the state. And really fundamental to the work we do is self-advocacy, is helping individuals with developmental disabilities and intellectual disabilities be their own spokespeople. Have opportunities to speak up about the direction of their lives, to self-determine the course of their lives, and to help them not only find ways to make their voices heard, but to help them find opportunities to make their voices heard, whether it be at the legislature, whether it be with state agencies, with municipal governments, even in their workplaces or in the programs that serve them if they are DDD members and all-text members. So it is really helping them to advocate for themselves on a daily basis. In Arizona, we have some real priorities that may be different or in many cases may be aligned with the councils in other states. We do a fair amount of original research. Several people on our staff are research specialists or have background in research. We also contract out or grant out funds to other entities to do research related to IDD. We do a lot of work to support the education community and advocacy within education, but also advocacy more broadly. The council is a grant-making entity, so we issue requests for grant applications several times a year, and the grants typically, or the projects typically will fall within one of the 5 work areas that are identified in our state plan, and I'll talk about those work areas in a moment. But those grant applications are open to nonprofit agencies as well as for-profit agencies. We work very closely with the universities around the state. We work very closely with a number of large and small nonprofit entities to help accomplish the work that we all have in common. But again, the foundation of what we're trying to achieve is greater self-advocacy, greater self-determination on the part of people with IDD, and making certain that the state, programs within the state, the communities within the state are providing equitable opportunity for people with IDD in every aspect of life. And that can be housing, it can be employment, it can be public services, it can be transportation. In fact, we like to use a visual to demonstrate what we're talking about with equity. And I'm guessing probably that many of you have seen this before. You see a group of individuals looking at a soccer game, and it's World Cup season, so it makes sense that this is a good graphic for us. But not all of these individuals are the same, and the accommodation that's being provided to them, a box to stand on to look over the fence at the game, is equal. They all get the same thing, but it's not equitable. It's not providing each of them what they need in order to have a fair opportunity to watch the ball game. So the one on the left is just individuals with a box to stand on, and obviously the person with a wheelchair can't stand on that box. But if we adapt those accommodations to the individual needs, we can see that everyone benefits and everyone has a chance to participate in community life. An even better one, perhaps, for this audience, and this is a new graphic that the Robert Wood Johnson Foundation just put out. It has a transportation motif. Instead of just providing a pedestrian crossing sign at a corner where everyone has to sort of take their chances on getting across the street, we as a society make other accommodations. We provide stoplights, we provide walk or don't walk signs, we provide audio and visual cues to help individuals with a variety of disabilities safely navigate the circumstances of their lives. So that is really what the council is about, and what many of our colleagues in the community, our partners in the community, are all about is equity and self-determination for people with IDD. Now, among the priorities that we address at the council on an ongoing basis, and one that's been really front and center in recent years, is protection from abuse and neglect and exploitation. Ever since the really horrific incident at Hacienda Healthcare back in 2018, prevention of abuse has been something that has really been front and center for the council and for a number of our partners. We also work in making sure that healthcare, the healthcare environment is equitable, and much of the work during the pandemic was focused on the crisis standards of care plan, or ensuring that people with intellectual and developmental disabilities were given equitable treatment and given an equitable opportunity to get the medications, the vaccines, whatever might be necessary for them to survive the pandemic. We also work very, very heavily in employment. And again, a number of people on this call are people that I've worked with in the past on employment issues, on opportunities for individuals with IDD to compete, to work in competitive integrated settings and receive minimum wage or better rather than sub-minimum wage in their work settings. And then, of course, we have some special programs in areas such as supported decision-making and future planning that are directed at helping individuals, again, self-determine the course of their lives, but also have the resources in order to live the best possible life given their individual circumstances. We operate on a state plan, and we are required by our federal funding agency to submit a plan every 5 years. And this year, or for the next several years, we have 5 key goal areas within our plan. They are self-determination, which I've talked about already, meaningful careers, again, employment, but not just employment, other opportunities to contribute to the community and to design the kind of career, whether it's a paid career or a volunteer career that an individual might wish to design. Inclusion with engagement, and that is not only being a part of a community, but really being embraced by a community and having full opportunity to be involved in the community, to be included in every aspect. Then safety, again, going back to things like abuse and neglect prevention and other means of providing safety for individuals with IDD who often are quite vulnerable in their communities. And then system access and navigation, making sure that the systems that serve people with disabilities are designed in a way and are navigable in a way that people with cognitive challenges can actually utilize those systems, can understand those systems, and can most effectively take advantage of those systems. I want to very, very quickly just highlight a few of the council-funded projects over the last year that we take great pride in, that we think are really valuable for Arizona and even beyond the borders of Arizona. One is a self-advocacy network that is a project that's being led by Southwest Institute for Families and Children. And the key to this is to develop a real network of self-advocates around the state of Arizona. Self-advocacy is challenging, it's difficult, it's labor-intensive and time-intensive, and helping self-advocates, again, people who often have cognitive challenges, helping them become good spokespeople for themselves is difficult work in many cases. And it requires that we interact directly with individuals, that we teach them the skills, and that they then teach those skills to other self-advocates. It is really rewarding work despite the challenges, and it is something that the council really is never going to back away from. It is something we will continue to do throughout all of the time the council exists. And we're really proud of this project because it is truly building a network of self-advocacy organizations around the state of Arizona. We're also especially proud in the self-determination space about work being done at the Sonoran University Center for Excellence in Developmental Disabilities down at the University of Arizona on a project called the Transition Ahead Roundtable. We're especially proud of this because it's offering opportunities to really underserved communities, Native American communities, Hispanic communities, communities of children from the foster care system and the juvenile justice system to look at what they wish to achieve with their lives, and then to plan out that goal or those goals, and to get the professional help they need to help realize those goals. For a lot of these kids, it's assumed that they might never work or they might never get higher education. But through this program, they're being given opportunities to realize how possible it really is for them to achieve those things. And then we're working with the Arizona Center for Disability Law on the Special Education Advocacy Program, again, with special emphasis on kids in foster care and kids in the juvenile justice system to get appropriate educational access, to get appropriate educational services to help them make the most of their educational years. This is providing one-on-one assistance, it's providing training, it's helping them become, and them and their family members become good advocates and self-advocates within the education system around the state of Arizona. We, as I said, are working heavily in employment, and we have a project going with the Institute for Human Development up at Northern Arizona University, focused on helping kids with intellectual and developmental disabilities plan for higher education. This is an area that for many, many years, kids with IDD have sort of been excluded from. There's been a presumption or an assumption that they couldn't work within a collegiate environment. But in fact, through programs like this one, we're helping kids design a program specifically for themselves. Now, it might not be a 4-year degree, it might be a community college degree, it might be a vocational program, but it's helping them see that there is something beyond high school potentially for them and helping them determine how they wish to structure the course of their employment life after they graduate from high school. And then a series of webinars that we and members of the Arizona DD Network and some other organizations throughout the state helped to produce over the last 6 or 8 months is really making it possible for people to understand the possibilities that are out there. For a lot of people, again, presumptions or assumptions that employment is not an opportunity for people with disabilities, but in fact, through the various resources that are available, through the various expertise that we brought together for this webinar series, we're helping to show them that there are opportunities out there if they know how to avail themselves of those opportunities and where to turn for the support to make things happen. In the inclusion area, we are supporting the development, have supported the development of what we call the Data Hub, or the Community Disability Index. It's a page on our website that provides a range of information about individuals with disabilities around the state of Arizona in various areas, in education, in housing, in transportation, in several other areas. It allows people, researchers, journalists, a variety of other people, or even just the layperson to access data about people with disabilities and to learn more about the disability community in the state. Now, we're beefing up this system actually over the next year and adding additional information specifically about people with intellectual and developmental disabilities. We have a data sharing agreement in the works with the Division of Developmental Disabilities. So we're not providing personal data, but we are providing aggregate data about people with disabilities and intellectual and developmental disabilities in particular to help raise awareness about this community within the state of Arizona. Under safety, earlier this year, the DD Council plus the Autism Coalition of Greater Phoenix, or the Autism Society of Greater Phoenix, and the Center for Disability Law issued a report on crisis response for people with IDD around the state. What we know anecdotally and what we've learned through various research projects is that crisis response in the state for people with IDD is nowhere near what it needs to be. There's too little understanding on the part of first responders, too little understanding on the part of law enforcement about the unique needs of people who have cognitive disabilities. And so we're working hard to make sure that the systems, especially with the rollout of the 988 system, that the various systems around the state understand the IDD community and can respond appropriately when members of the IDD community are going through a crisis situation. In particular, we are, of course, trying to prevent suicides or self-harm, but there are many other situations. We're trying to prevent harm to others as well. There are a great many situations in which we need better trained and better qualified individuals. And it's not a knock on the systems that exist. It's simply more a lack of resources than anything else. We're trying to ensure that those resources can be made available so we can do the best job of responding in a crisis situation. We also continue to support what used to be known as the Arizona Sexual Violence and IDD Response Collaborative. It's now known as the Sexual Violence and Disability Network. It's a project with the ARC of the United States and the National Center on Criminal Justice and Disability to formalize a system, a network of agencies that are continuing to work to prevent abuse, physical abuse and sexual abuse of individuals with IDD around the state of Arizona. We're very pleased with the work that's been done. This collaborative has been in place actually since before the Hacienda incident, and we're hoping it will continue for many years to come. We, of course, would love it if there was no need for it to exist, but we just know that abuse and neglect continue to happen among this community, and we're trying to do everything we can to make sure that it can be prevented or that it can be appropriately responded to when it does occur. Another program that we're very, very pleased with, very proud of, is the establishment of the Native Disability Center, also at the Sonoran USAID at the University of Arizona, a really wide-ranging initiative to provide better disability resources, better access, better knowledge and awareness to the tribal communities around the state, led by members of those tribal communities and modeled on a program that was developed at the USAID at the University of South Dakota several years ago. It is really, we think, a model that has great potential. It's one that has already gained some attention from federal agencies who want to use the resources being developed to serve tribes all around the country. So something that we're very pleased with and very proud of. And this is just a sampling of the kinds of programs that the Disability Planning Council Developmental Disabilities Planning Council, I'm sorry, has supported over the last year. It's much more wide ranging. You can see on this slide a whole host of other organizations that have benefited from grants or contracts from the council. We are confident, we know from the data that we've accumulated that the work is making a measurable impact. We, of course, can't take full credit for it because we're, in many cases, just providing the resources, and the grantees are doing the work. We're tremendously grateful for their expertise and for their efforts to make this work happen. We look forward to continuing to work with communities around the state, to continuing to act on behalf of the IDD community. We know that there's a lot of work still to do, and the areas in which we're doing work right now are meaningful, but they are not the be all and end all. That is not an all-inclusive list. We know that there's a lot of work still to do around cultural diversity in particular. We know that healthcare is an emerging and will continue to be a growing area of need for the IDD community in years to come. We also know that we can only continue to do this work in partnership with organizations and agencies around the state. So we look forward to opportunities to partner with folks on this call and folks who are not on this call. If anyone would like to know more information about the Arizona Developmental Disabilities Planning Council, the work we're doing, the grants we intend to fund over the next year or two, I welcome a call or an email from anyone. We really would look forward to an opportunity to partner in meaningful ways. And since this is a call very much focused on transportation issues, we fully recognize that transportation is a challenge in many, many ways and in many, many communities for people with IDD. And we would look forward to some opportunities to discuss how we might work with people to address those challenges in time to come. Thank you very much. I will stop sharing the screen now and be happy to answer any questions you might have.
Thank you, John. We greatly appreciate your presentation, and we did have a comment in the chat that this is wonderful information. Thank you for sharing the Planning Council's goals going into 2026. Definitely, we would like, I hope that those here would take the opportunity to reach out and participate in some of these programs. This pains me to say, but I have to say, the Sonoran you said, which is from the U of A, has an ASU alumni. It's a great resource. I am on their newsletter. I've attended a couple of their Native American webinars. They have programs, they have studies that go out. Definitely, it's such a great resource and a wealth of information that they provide.
Well, and I don't mean to interrupt, but I wanted to let you know that we are actually in a project with ASU right now as well, with the Center for the Future of Arizona at ASU. So we're trying to touch bases with all three of the state universities and make sure that we've got a strong relationship with them.
Awesome. That's great. That's great to hear. And definitely, I think a lot of your projects, that's a wealth of information you provided us, but a lot of your the projects that you're working on could be a presentation in itself, especially one that comes to mind that really hits on current issues is the Arizona crisis response, your policy recommendation. I think with the current environment that we're going through, that is such a definite that it would be very beneficial, and I definitely would like to hear more information on that. And we may invite you back again to provide some information on that.
Happy to do so. Thank you.
So does anybody else have any questions? I have a lot of questions, but does anybody have any questions or any comments? Again, we greatly appreciate this. I know that must have been a running start for you to take on in March, especially with all of the programs going on. But this is, we hope that you take this information back, the resources back to your community, to your organizations, share it, and know that there are resources out there that can provide you with so much information, especially since you are the service providers on the front line, providing services to the older adults and persons with disabilities. We do have some, comments saying, thank you so much, John, for your information. And again, with all of our presenters, if you have any questions, if you think of something afterwards, feel free to email John or myself, and we can get that to them. We do have a comment, and my comment was about the individualized higher education. I didn't know this was happening, but it's so needed.
Well, thank you for that comment. It is kind of a well-kept secret, I guess. In fact, and we're seeing this in more and more university and college settings around the country, that programs are being developed to recognize the potential of people with intellectual and developmental disabilities to participate in higher education. And it's really gratifying to see it happening. We are especially pleased with the program up at Northern Arizona University because it provides so much focused one-on-one attention. And it really is not, it's not a cookie cutter approach. It's helping individualize programs for people depending upon their particular circumstances, their needs, their desires, the kinds of outcomes they hope to achieve. So it's a great model, and it's not the only model, but it is a really fantastic model that's seeing a lot of success and now has actually expanded beyond just NAU to serving 4 different community colleges with a recent relationship established with Arizona Western College in Yuma. So it has tremendous potential and replicability, which is kind of the thing that we want to see. We want to see things that have the potential to be sustained over a period of time.
Thank you, John, and thank you, Samantha, for that comment. And again, if you have any interest in any of the projects, we would greatly welcome John back again to provide some more information on him. So thank you, John. And have a great day. Happy holidays. I would now now this portion of the agenda is an opportunity to highlight the great work that you as service providers are doing for our community. And today we have with us is Melanie Soto, who is now the executive director, I believe probably in March, since to provide an overview of the programs at the ARC of Arizona. Thank you, Melanie, for joining us today.
Thank you for having me. I really appreciate it. So if we can go to the next slide and the next slide. So like Dee Dee had said, I am Melanie Soto. I'm the new state director for the ARC of Arizona. Actually came into the role in July, but I've been with a local chapter for about 20 years now, up in the Cottonwood area, so northern Arizona, Yavapai County. And I have several family members with IDD, so this is a passion for me for this career. And I was very sad when John made the announcement that he was moving, but he really didn't move very far. We still work pretty closely together, as you've seen from his presentation. There's a lot of grant work that we do hand in hand, so we're really appreciative of that. So what do we do? The ARC of Arizona promotes and protects the human rights of people with intellectual and developmental disabilities, affectionately known in our community as IDD. We are a community of acronyms, and we try to be mindful of that. And we actively support their full inclusion and participation in the community. We are the only community-based nonprofit working for people with IDD throughout their lifetime and across all diagnoses, from autism to Down syndrome, Fragile X, and 100 other developmental disabilities. Next slide. Creating change. The ARC of Arizona partners with local chapters throughout the state. I saw that Billy Parker is on the call today, and he's with Chandler Gilbert ARC specifically. In Maricopa County, we also have the ARC of Tempe, but we do have chapters throughout Arizona. It's also a national network of state and local chapters. And we partner with the ARC of the United States and provide a variety of resources to empower individuals with IDD and their families and educate others about the IDD movement. Recently, there was a study conducted about the community awareness about people with disabilities, and it was found to be extremely low. And so we've kind of shifted our focus right now on trying to educate the community more about IDD issues. As far as public policy goes, we work with experts at the national, state, and local levels to ensure that our elected and appointed officials understand the needs, issues, and concerns of people with IDD, and that federal and state laws and regulations help to promote full inclusion. So we are working on all different levels, utilizing grassroots actions to effect substantial and meaningful progress in the legislative landscape. Next slide. So our current initiatives, John did speak about several of them. So I'm going to kind of just do a very soft overview of them. The health and equity awareness that we are doing, we have a couple of different grants that are helping to facilitate that. As John had pointed out, there is a lot of inequities that are happening, and especially in the health field. During the beginning of the pandemic, what we saw was a major focus on hospitals and nursing facilities, while congregate settings that provide services to individuals with IDD were kind of left in the background, even though there was still a high-risk population that needed to be addressed. So in partnership with the Arizona Department of Health and other organizations, we've been working really closely with them to fix the issues that we have found and bring more education to families, especially about COVID vaccinations and the importance of individuals in congregate settings to receive those. The other project that we've been working on is supported decision-making. Many states all over the United States have passed legislation that requires supported decision-making to be an option prior to guardianship being granted over an individual with IDD. Here in Arizona, we have not successfully passed that legislation, but we are still working towards that goal. And what that does is it helps families understand that there's an alternative path to guardianship, that if it's not necessary, that you can sometimes have more success while an individual is able to retain rights over themselves. We can use supported decision-making to further positive impact in their life without creating more unnecessary restrictions. The Arizona Sexual Violence and Disability Network, John had briefly touched on, we are working in collaboration with that. And then we have two major fun events that we do throughout the year. One is our Wings for Autism. What this project does is it's in collaboration currently with Sky Harbor International Airport, American Airlines, and the city of Phoenix. And it creates an opportunities for families to test out the flying experience with their children who have IDD. I got to experience my first event in October, and it was extremely touching and moving to see families that had been very reluctant on trying to fly, be able to go through that security process and wait patiently to board the plane, get on the plane, taxi around the airport, and then disembark, and really now know that they could make flying an option for their travel to see loved ones or be able to respond to emergency situations that require them to be able to get somewhere quickly instead of making that decision to pack everyone in a vehicle and hope for the best. So we are excited. We are actually in the process with Mesa Gateway Airport. They have reached out to us and said that they would like to also possibly do an event in June. So we're working out all the final details on that, but we are hoping to expand to another airport here in Arizona. The other event that we do is the Sprout Film Festival, and that is in collaboration with Chandler Gilbert Arc. So thank you, Billy, for working with us on that. And it's kind of a twofold project. It's also to bring awareness about individuals with IDD through short films that star or made by people with IDD. And we present them at the local high schools throughout Maricopa County. And then also we try to make sure that we have an event that's open to the public through this film festival. And it's all about education and awareness. And we really enjoy seeing the impact that it has on the community. Next slide. So if you have specific questions, there is my contact information on the screen, but I do have a short video that we did want to show you. So if you could click on the blue "It's Possible" wording, it should pop up.
Give me just a second, it's low.
No worries.
Every year, thousands of children are born with a disability. With the right support, they'll go to school, have fun, and make new friends. Some will go to college. Others will go right into good jobs. They'll be a part of their community, their family, achieve their dreams, fall in love, and plan for a secure future together, just like we all hope to. Visit thearc.org/possible to see what is possible.
Thank you, Melanie.
Thank you for playing that. Yeah,
Thank
if anyone has any questions.
Yeah, thank you, Melanie, for your presentation. Again, this is an opportunity that we highlight the great work that your organizations are doing for our community. We have in our chats, thank you. And thank you, John. Thank you, Melanie. And kudos to ARC for all of the programs that you have. It was surprising regarding your supported decision making that didn't pass, that we are still not at the point to give those individuals that still have the ability to make their own decisions that right. I know with family members that has been an issue regarding guardianship and the individual still being able and willing to still have control over the decision making on themselves. That was a little surprising for me to hear.
Yeah, what we found is there's still kind of that old notion of fear that happens, and even within the school system where individuals are instructed at the age of 14, 15 that they need to start working on guardianship now, because when their child turns 18, they're not going to have any control or input over their life. And that's not true. There are other avenues where a family member can be supportive of that person reaching all their goals while still staying in safe environments and making good decisions that will positively impact their lives.
Thank you. And thank you to the ARC organization for taking that advocacy role and a lot of the programs that you provide. Wings for Autism, it sounds like a really great program. Also, the Sprouts Film Festival. I am so glad that is coming back again. We know you have a sellout every time that happens in your film premiere. Definitely, if you have any events coming up that you would like to share with us, we do have a newsletter here at MAG for our stakeholders here that we will definitely share with you. We do have a question that says, when is the film festival?
So we're looking at right now, the school portion of it, I believe, is on March 3rd. We're just finalizing up with McClintock High School that they're going to have that available for us. It'll be shown in all the classrooms during different, we're going back and forth if it's going to be different times of the day, but there will be that evening event that'll be open to families. And then individuals throughout the district. We have not finalized a date yet for the public viewing at an actual theater. But in
Thank
the
you.
spring, that's our goal.
And thank you. As you mentioned before, Billy is with Chandler Gilbert ARC, and I'm sure he will provide us more additional information as soon as the Sprouts Film Festival gets, you have a future date for that. So thank you. Billy says absolutely. Do we have any questions for Melanie or any comments? Again, thank you for all the work that you do. Thank you for taking on the helm of the ARC of Arizona and all of the great programs. And thank you for presenting here today.
You're welcome.
Thank you and happy holidays.
Happy holidays.
Again, as with all of our presenters, if you have any questions after the fact, if you want to email it to Ezekis and I, we can get it to Melanie, or you can email her directly. And our presentation will be on our MAG website. And again, another comment is great information. Great information from all of the presenters. Oh, thank you so much. And that's what we work hard to do, is to provide, bring presenters that will provide information that will be relevant to the work that you do. And I guess, our major purpose is to focus on the transportation aspect of it, but we know there are other aspects of the work that you do. We know that a lot of you are not solely transportation providers. You're providing transportation because there was a need. And over the course of the year, we have covered a lot of issues facing our organization, the agencies, the providers, such as catalytic converter thefts. We have provided more information on what is preventive maintenance regarding the Section 5310 application process. And with this presentation highlighting the great work you do as service providers and the value that you add to our community. Again, if you would like to volunteer to present at our next meeting for the agency spotlight, please contact myself or Ezekias. We are always glad to share the great work. And we know all of your agencies have great programs. You're doing great work. You're on the front lines, and we would like to celebrate that with you. We also appreciate you answering our polling questions and surveys. They help us to develop workshops and trainings. As an example, your feedback helped us to develop the de-escalation workshop that was offered by Gompers. And we had over 80 participants. And I think that is more than some of our TAP meetings attending those workshops. So we greatly appreciate your feedback and your comments. We will be moving forward on the 2023 Section 5310 application. We will send out emails, we'll provide information in our newsletter, and we are currently working with Phoenix. It has Wendy had provided some updates to some of the guidelines for our next application process. We are finalizing the application and handbook, and I anticipate releasing the application in late January. As a reminder for those that have applied in the past, and thanks to Ezekias, we have developed a applicant dashboard where we can provide you information on where you ranked on the priority list for past applications. We can provide you information on which categories in the application you did well on, and provide you some information on categories where you may need a little work on. So please reach out to myself or Ezekias if you'd like to set up a meeting to discuss your past application. And for those agencies that are interested in applying for Section 5310, the grant program, feel free to reach out to myself and Ezekias again, and we will be more than happy to set up a meeting to provide you information on the grant program and what to expect. We look forward to continue to work with you in our new year. And also, I want to remind you to continue to reach out to our sub-region mobility managers who are a great resource. If you have any questions regarding the Section 5310 program, or you have any questions regarding your fleet management, or you want to provide any feedback, please reach out to our mobility managers. And that is a great segue in introducing our next presentation. Our next presenters will be our sub-regional mobility managers. They have been very busy planning for our next round of trainings and workshops for 2023. And I'd now like to introduce our sub-regional mobility managers to provide an update to you. Unfortunately, Billy Parker is under the weather, and he will not be able to provide the presentation, but I would like to introduce Ezekias to provide Billy's updates. So Ezekias.
All right, let me just do something over here. Thank you, Didi. Billy did provide me some of his updates since he's not being able to present today. He has been working in a few projects. One of the projects that Billy is working on is the brokership model. And on that project, he has been doing continued research on various options for coordinated mobility, including but not limited to shared ownership of vehicles, coordination of rides between agencies with a single point of contact, and coordinating using a third party for a single point of contact as well. Another project that Billy has been working on is the vehicle disposals. This is due to considering the development of, he's trying to consider a development of a standard operating procedure that provides a step-by-step process that subrecipients of the 5210 grant can use to more easily dispose of vehicles that got to the end of useful life. Through donations or sales or auctions or transfer to other subrecipients. He does explain that this project involve gaining understanding of vehicle disposal from ADOT and the city of Phoenix and the guidelines that they need to follow in order to create that standard operating procedure. Another project is that Billy continues to offer quarterly trainings and guided discussions on vehicle sharing, disposal, and other topics. For Billy's workshops and trainings that he has been working on, he has the Let Me Out of This Box, which is focused on vehicle transportation and resource sharing strategies. It involves training on Chandler Gilbert RX vehicle sharing process and includes information and guides and guided discussion on sharing vehicles and vehicle disposal. Another workshop and the guided discussion that Billy is working on is It's a Moving Target, which is focused on business strategies in evolving times. This workshop does not have a specific agenda, but instead they have an evolving agenda that is started back with COVID-19 pandemic and best practices, and has evolved to include coordination in transportation and ARP funding, recruitment retention, preventative maintenance funding, and 5310 proposal tips and ideas. So he has some of these workshop schedules already for next year. I will be following up with emails to our subrecipients and stakeholders on the schedules for those, but he has some for April, August, September, and also May of 2023. And Billy also wants to mention that with the things that Didi mentioned about the 5310 application, that he and the other mobility managers will be assisting with the proposal assistance workshop. This is something that he provides, but with the request of MAG staff. And on that one, they share tips and ideas for writing 5310 proposals on preventative maintenance proposal ideas and discussion, and how to be successful on your 15 to 10 interviews when it comes time for that. So that's Billy's update.
Thank you, Zacchaeus. Great job. You did a good job. Um, Billy has been doing a lot of workshops, a lot of trainings. And again, I would definitely take advantage of Billy. If you're thinking of applying for Section 5310, Billy is offering a workshop. It's more of an open dialogue on it's kind of a peer-to-peer discussion on best practices of how to write your 5310 application. If you have any questions, if I know a lot of times you have questions and sometimes you don't want to express it at the meeting to myself or Wendy. Billy is always open. His workshop, you can, feel free to ask any peer-to-peer questions regarding application. So thank you for doing that, Billy. And he says, thank you, Ezekiel, for that. And he hopes to have a voice again. So next, I would like to introduce Mark Botterbosch from Gompers to provide an update. Mark.
Hello, I apologize. I'm having some bandwidth issues, so I can't turn my video on. But we're going to continue to provide the transporting people with special needs training and continue to have that evolve. In fact, it's reached the point where now we're going to break it off into 2 trainings because there's the topics we've added have taken it kind of too long for one training. So that's exciting. We're also, what we want to add for next year is actually interviewing people with disabilities that provide or receive transportation and get direct input from people. What is your experience? What works well for you? And actually get some input from people receiving the transportation. So we're excited about that as well. I'm moving into a new role at Gompers effective January 1. So I'll be transitioning out of the mobility manager, but our special education director, Travis Harris, will be stepping into the role. So nothing will be changed. And we've at Gompers really focused on everybody there can be a resource for MAG. So that will continue. Travis will be kind of like a centerpiece, and whoever, if it's facilities, if it's me, Heather doing trainings, he can pull in whoever's needed. So as far as supporting MAG, Gompers will continue to do that with all the resources we have. Thank you.
Thank you, Mark, and congratulations of being now the executive director at Gompers. And we greatly appreciate Gompers' support in assisting our sub-regional mobility management program and making available your staff to assist us. So thank you so much to you, Mark, and the work that you do and for Gompers.
Thank you.
Next, I would like to introduce Justin McGregor, our sub-regional mobility manager, to provide some updates. Do we have Justin?
It looks like we lost Justin.
Okay. And this is just an example that our sub-regional mobility managers are also staff, working, on programs and projects at their own agencies. So we can provide you with Justin's updates in our presentation that we will load onto the MAG website. I would next like to introduce Eric Pinnock, our newest sub-regional mobility manager from TCH.
Good afternoon, everybody. My name is Eric Pinnock. I'm the Fleet and Facilities Manager here at TCH. I've been with the company for 4 years, and I've been just starting my second year as a mobility manager. Some of the presentations that we've been working on are, the first one is titled Enhancing Mobility Through Technology. This goes over all of the various ways you can use technology to enhance your services and provide provide better transportation and take better care of your fleet. That presentation will have the tentative schedule is for June and October of next year. Just last week, I had a meeting with a transportation manager from another nonprofit who is interested in the computerized maintenance management software that we use for our fleet and facilities. So I gave him a rundown of that and showed him how we use it to take care of not only our fleet and our grant vehicles, but also all of our buildings and group homes and various properties throughout the state. The other presentation that we're working on is titled Fleet Management and Data Reporting. This presentation focuses mainly on fleet, and it goes over all the various things that you may need for the grant process and the milestone report. It goes over all of the documents that you may need to create and save to take care of your fleet. And then we're also getting some help from the city of Phoenix and Wendy Miller with this. They're providing some best practices to help keep track of all of the maintenance records for reimbursement and to fill out the milestone report to make sure that you're taking the proper steps to ensure your fleet is well maintained. I've also been fielding some questions lately from other nonprofits and other agencies that are interested in becoming subrecipients. I've helped to provide a brief overview of the MAG process to them and passed along some contact information and documents to help get them introduced to the grant process. So those are some things that I've been working on lately. Thank you.
Thank you, Eric, and all of our sub-regional mobility managers. Please reach out to them. The sub-regional mobility managers are a resource for you to support you in the services that you provide. We know you are the ones on the front lines providing these services, and we greatly appreciate your time here today. To the mobility managers, we appreciate your time. For those attending, we know you have a very busy schedule, and we hope all of the presentations provided you some information that you can take away. Thank you to all of the speakers, and thank you for all of you for your time here today. I would like to wish everybody a happy holiday. And yes, thank you for all the work that you do. We look forward to working with you in the new year. If you have any comments or feedbacks, or if there's any topics that you would like us to cover, please feel free and reach out to either the sub-regional mobility managers or Ezekias or myself. We wish you happy holidays, be safe, and take care. Thank you.
Thank you, everyone.
And we give you a gift of time. We give you